Hey, Carmen here. Happy Wednesday. I'm super excited to be here. For those of you who do not know me, my name is Carmen. I am a myofunctional therapist, speaker, educator, all the things myo, and this is what I do. I come here every week to educate and teach and talk sense into some of you. So, which kind of leads me to a fun, if you can call it, fun topic today. So I wanted to talk about questions that you're not asking, that you should be asking. And so as I was trying to think about what I wanted to narrow that down to, I was really struggling to narrow it down to one big question that everybody should be asking. So I narrowed it down to two. I just want to let me make sure that I am indeed live. There's a little bit of a lag, so hopefully. Let me refresh. We'll let that refresh and then we'll come back to it so that I can make sure. So when I narrowed down to two questions that, in my opinion, remember this is just my opinion, what people should be at, what questions you should be asking, but you're not. Okay, so those two questions. How does myofunctional impairment connect to my wellness? And then what are the long-term consequences of ignoring my myofunctional impairment? So many of you learn this information and then you just stick your head in the sand, or you just are in denial and you think there's no connection whatsoever. You guys, if I had $10 for every time somebody said, well, there's absolutely no way that my swallow could be connected to, A, B, and C, I wouldn't be doing what I'm doing, because I would be laying on a beach in Tahiti with a drink in my hand, because I would be very wealthy, because so many of you just don't understand this connection and this connection, and you don't understand the connection in the body, all of these different things. So those are the questions that I think you should be asking that you're not. You need to be asking those questions of to yourself, to your myofunctional therapist, to your doctor. It's hard to just nail it down to one person. So I'm going to dive into those. What I say is, if something here that I'm going to talk about today sits on your heart, my God, if it speaks to you, if it's you, don't ignore it, because it can be long-term consequences. And we're going to talk about that. So first, let me answer the question, how does myofunctional impairment connect to wellness? So many of you who follow me on social or interact with me privately, you know that I'm always preaching wellness. So wellness is this huge umbrella. I'm not talking just about tongue ties. I'm not talking just about correcting your tongue thrust. That is because I understand that those are all pieces of a bigger puzzle, and that being your wellness. You cannot be your best, your healthiest, living your best life, chasing down your dreams and goals, all of those things, if you feel like poop, if you can't get off the couch because you have no energy, and so all of those things go back to some things. Now, what I don't want you to be hearing me say is that myofunctional therapy is snake oil. I'm not trying to sell you a used Subaru, okay? I'm not a used car salesman. I just want you to understand how certain things can help improve your wellness, okay? So let's talk about that. First, I want to talk about mouth breathing. Oh my goodness, another thing that I talk about all the time. If you are mouth breathing, your body is constantly in fight or flight. You are 100% of the time outrunning that saber-toothed tiger. You're climbing that brick wall. You're trying to get away from it. Your body never gets to rest, relax, digest, repair, all of those things. So when you're mouth breathing, you are always stimulating your fight or flight, which means, guess what? Your cortisol levels, which is a stress hormone, is through the roof. There are so many concerns with elevated cortisol levels, but we don't need to live that way. We should not. We absolutely should not be living like we are going to be dinner for a saber-toothed tiger all the time. Mouth breathing does not come easy. Many of you, I know, want to go get mouth tape, and I'm here to tell you, sister or brother, that if you put a big enough piece of tape on your mouth, you're going to hold it closed. but you're not going to correct what is causing that. So I don't let my clients do it. Many of you guys already know that because many of you are clients of mine. I don't let you mouth tape until you're nasal breathing 90% of the day, because I don't put Band-Aids on bullet wounds. I help you correct what is wrong so that we can get that right, okay? Same thing is kind of like if you wanted to lose weight and we taped your mouth shut or stapled it shut, you're going to lose weight, but we're not solving the problem. So that it's a Band-Aid. So when you learn how to nasal breathe, you start to activate that parasympathetic system. You can relax. There's a whole list of benefits for nasal breathing, and I know you can go find that in my blog, so I'm not going to dive into that. Let's talk more about wellness, craniofacial growth. Tongue posture is going to affect that. So if your tongue is low, that may change your craniofacial growth. So as an adult, you're like, I'm the way that I'm going to be. There are some changes. I mean, they do adult or expansion, those type of things, but pretty much like this jawline, this mouth breather jawline is going to be a mouth breather jawline till I die, right? But it has an effect on your overall wellness, because especially when we're talking about kiddos, and you guys know I talk a lot about kiddos. As a parent, you should be watching for misguided craniofacial growth, because if you can keep your kiddo from having those craniofacial growth problems, then you're helping the airway, you're helping the malocclusion, the teeth, the skeleton, different things like that. So keeping an eye on that is super important. Can we talk about snoring? Snoring, mouth breathing at night, all of these things, anything that causes poor sleep, you guys, is a symptom of a bigger problem. You would be so surprised at how many people come to me and they say, my husband will suck the curtains off the wall because he is snoring so bad, but he just thinks there's nothing wrong with it. There are huge long-term consequences of that. We're going to talk about that just in a minute, but that's the airway distress. That's just kind of like the beginning, what I say. I always talk about kind of like a rung on a ladder. So we have mouth breathing, we have snoring, we have upper airway resistance syndrome, we have obstructive sleep apnea, and none of those are good. So insomnia, many of you have trouble with insomnia and you just think, well, this is it. I'm just going to be tired, exhausted, daytime sleepiness. I'm just basically going to feel like a pile of poop my whole life because I have insomnia and I don't sleep very well. Do you know that a lot of insomnia is your body saying, hey, nope, there's an airway problem, and rather than you suffocate me all night, I think we'll just stay awake. So it has huge concerns: weight gain, depression, anxiety, a whole bunch of things that I'm going to talk about here in just a minute are affected to your sleep. Okay, so has a big connection to your wellness, your overall wellness picture. Let's talk about digestive issues. This is an area where I have clients who have amazing results, and that's just because we have to correct the mechanics of their swallow. Many of my clients have huge digestive problems because they have rapid eating concerns. They don't chew their food well. They have lots of, like, they're getting medicated for one thing, and that's the problem. Is if you go to somebody who is not a piece of the puzzle, who doesn't understand myofunctional impairment, they're going to give you potions, pills, that kind of stuff. Is that going to solve the problem? Maybe, but maybe not. I can guarantee you, if you go to a doctor and they give you a pill for IBS or something like that, they aren't necessarily saying, well, hey, let's review your chewing. Let's review your swallowing. Are you swallowing air? So many things. The same thing with allergies. Which when I talk to clients who are medicating, I'm always saying we want to get you off those medicines. That is better for you. But if you go to the allergist and you're having problems with allergies, they're going to give you a pill, which is fine if we have to have that at the beginning to help get the nasal congestion under control. But eventually I want to get my clients off. So digestive issues are a big thing. You probably just think it's your normal. You're not thinking that it affects your overall wellness. Clenching and grinding, we're going to talk about that in a minute. But if you are clenching and grinding, typically, we always say that's an airway crisis. But what are you doing to your teeth? Sure, you're giving your dentist money for a night guard, but it's not stopping the problem. It might prevent you from cracking teeth, crowns, that kind of stuff. So there's definitely a purpose, but that affects you. What happens when you break all your teeth? And it affects your way of life. As we get older, and many of my older clients, they can certainly testify to the fact that chewing matters, and being able to eat really enhances their life, and they kind of like it. Last, I want to talk about medicating. So when people are asking me the question, well, Carmen, how does all of this connect to my overall wellness? And I'm educating them, teaching them all these things. Go back and look at your health history. If you're writing down a health history that has a list of meds this long, look at them. Are you medicating for acid reflux? Is that because of how you're eating? Is it because of your rapid eating behaviors? Is it because of your tongue tie? Is it because of your chewing issues? Is it because of undiagnosed sleep apnea? Huge, huge concerns. Okay, so let's bebop over now to talk about the long-term consequences of ignoring myofunctional impairment. So this I get asked a lot. Mainly it is in an email when people say, hey, Carmen, I know I have concerns. I know therapy is expensive and I just can't do it. And basically I haven't starved now, or I haven't had these, type of different problems. So am I fine? Or what are, I'm good. There are no long-term consequences, right? Wrong, false. So first, one of the first things I want to talk about is choking. So I have a large patient population that's age about 60 to 78 is my oldest. These clients, some of which stuck their head in the sand when they knew they had concern years ago, and some of them had no idea. Either way, as they get older, many of them look back and they say that they've been choking, choking easily their whole life. And now combine that with getting older, it's a real problem. They're getting older, they're losing muscle tone, lack of or less coordination, I would say. So it's really challenging. And for these clients, they really wish that they had done something about it a long time ago, which kind of brings me to compensation. So I bet you I say that 100 times a day. Compensations eventually wear out, or, go by the wayside. So if you're gimping along and you've got a foot that's bothering you and you limp, you're throwing things off kilter. So eventually you're going to cause a problem somewhere else. So your body will compensate for so long, and then it just kind of goes by the wayside. So that's when I hear clients say, yeah, I totally used to be fine, but now I have, this increase in symptoms, and I'm seeing this problem and that problem, or headaches and, all sorts of different things. And typically the catch-all answer is, well, they've been there all along, but your body is getting tired of compensating for them. Let's talk about the long-term consequences of forward head posture. So posture is huge, and you guys have heard me talk about forward head posture. It's something that's very common in a lot of my clients. I myself went through therapy for forward head posture, and the bottom line is when somebody is doing this, it's terrible. It puts extra weight on the spine. So those little old ladies that we always think have osteoporosis, not necessarily. They can have extreme forward head posture, but you can see them, and they're all hunched over, and it's permanent. And I don't want to be there, and I don't want you to be there either. So understanding the concerns with forward head posture is very important. The other thing is, why do you have forward head posture? Is it going like this so that you can change this angle and get better air? Because if you think about it, we stand upright, so the air has to go in and straight down. So it has to take a corner, basically. So if you're going like this, for a lot of people, they're mouth breathing and they have forward head posture. There are long-term consequences of that. Long-term consequences of mouth breathing equals less oxygen. And any of us, we need more oxygen. Many of us don't think there's a concern. We think that either it's good or it's bad. We're either breathing or we're not. But if you're not nasal breathing, you're not getting nitric oxide, you are not helping the saturation of oxygen into the lungs. You're just on a cellular level not getting the best that you should. So learning to nasal breathe makes a big difference. Okay, and then last I want to talk about airway distress. My list here is so long because I tell people all the time, the reason I do what I do is because sleep apnea kills people. Eventually, complications of sleep apnea, airway problems, that kind of stuff can kill you. And dead is dead. It's final, you guys. So you got to take this stuff serious. High blood pressure, adrenal exhaustion, depression, moodiness. I see so many people who have been medicating for years for digestive issues and for depression, anxiety. And they really, if you do myofunctional therapy and you have improvement in those areas, some of those areas we see an improvement in breathing and digestion. You know, stimulation of the vagus nerve is going to make a big difference for sure. Chronic fatigue. How many of you do not think that being tired all the time affects your overall mental health? How you feel, how you operate. Do you feel like getting off the couch? Nope. Do you feel like going to the gym? Nope. Do you feel like eating right? Nope. And in fact, when you're not sleeping right, you're eating worse because that's typically the cycle that you're in. Dental problems. So broken teeth, recession. There are so many different problems in the mouth that you don't really think about when you're thinking about myofunctional impairment. Then, and you guys have heard me talk about this, stroke, diabetes, obesity, acid reflux or GERD, chronic pain. So many of you just live in chronic pain and you just don't know where to start. Degeneration. So I always say sleep apnea and these airway concerns is very degenerative. It's very aging. You're not getting the sleep that you need. And sleep really is, when I'm talking about this umbrella, sleep is what you want. The high cost of sleep apnea, Alzheimer's, stroke, those consequences are very expensive. And when people will say, hey, myofunctional therapy is expensive, I say, yeah, I get that. But so is Alzheimer's. So is stroke. So is treating sleep apnea. So look at taking care of your wellness and your health now so that you don't have to take care of your illness later. Okay, so next week, we are going to be talking about a couple things. So the topic of a preferred provider, and then I'm going to be answering some email questions. So preferred provider, you guys, I've shared my opinion on that before, so we're going to talk about it because it's really important because so many of you come to me and say, hey, I know I have a concern, but who should I go to? And so I'm going to talk about that. Next, let me put the link up here. So you guys know that my team and I spend a ton of time educating and serving our community. And so we have a couple new free classes that we're teaching. Next week for adults, I am teaching Become a VHP, your 6-step roadmap to becoming a vital, healthy person by understanding your myofunctional impairment. I'm going to be taking you through the assessment, really, and it's a deep dive. So if you have questions about whether you have concerns, this blog or this link for my blog that's on the screen right now is going to be where you want to start. Because if you have concerns for impairment, and I just got done talking about the questions you're not asking and how you're not understanding how things connect. So in that webinar, I'm going to be talking about that. So get that tool. Also, if you sign up for that webinar, which I'll make sure to post the link so that you have it because it's kind of long. I'll post it below this video when I post it in Facebook. If you register for that, you get a workbook and it has you go through the assessment tool so that you have that stuff all right there when I start lecturing about it. So that'll be on Tuesday next week. I'm teaching 2 of those classes. And then when you sign up to get that assessment tool, make sure that you check yes. Not because I'm going to bombard you with a whole bunch of stuff. I provide value to you and you always have the option to opt out. But if you check no, you don't get the invitations when I do these private training events. I'm going to be doing one a couple weeks after that called Don't Raise Ugly Kids. And that's going to be walking parents through questions that they should be asking, things they should be watching for, what they can do for their kiddos with myofunctional impairment. So super huge, important free classes that I'm putting on coming up. So make sure you're on the list so that you get the invitation to register for those. So the Don't Raise Ugly Kids is not open for registration yet, but the one for next Tuesday, which is the Vital Healthy Person one, that's for adults, that one is open. And last, let me put the link up here. Share us, follow us. We are small but mighty. We spend a ton of time educating so that you have kind of a North Star, if you will. So you know what to understand, who you can ask for questions. If you have a friend or a family member, somebody who has impairment, I just got done talking for quite some time about how it connects to your wellness and how it has long-term consequences. So you don't want to stick your head in the sand. I'm going to get out of here. I will see you guys next Wednesday, but hopefully I will see you in the webinar on Tuesday. I'm going to teach one in the morning and one in the evening time. So make sure you're on that list and do the assessment tool. I will see you guys next time. Have a beautiful week. Bye for now.